everyone. This is Ryan Hoyme, aka Massage Nerd, and today we have a very, very special guest, David Kent. Welcome.
Hey, how are you? Good to see everybody. Well, thank you for tuning in.
Yep. And how did you get involved in the massage field then?
Hey, it's a fluke that I'm in massage. Basically, I was in a lot of pain. I suffered from headaches, neck pain for many, many years. And it was, I was set up for some surgery, and I was taking a lot of medications, and bottom line, someone suggested I try a massage therapist, and I was full of trigger points, recreated a lot of my symptoms, and ultimately massage was a major part of getting me well. And today I never had that surgery, I don't take any prescription drugs, and I live pain-free.
Oh.
So I'm pretty happy.
Yep, and you got great posture sitting too. So.
Well, hey, you know, massage has helped me gain that.
Yep, and it's making me have better posture just by looking at you. What do you love about massage then?
What I love about massage is how much it's helped me. You know, it's I feel like it's really saved the quality of my life, because the massage I've received and that type of work has made me feel so much better. I've been able to take that information and that feeling and those situations that I've been in and help relay that information to my patients and also to other therapists. You know, a lot of what had happened when I first was exposed to massage, the therapist really couldn't communicate well with me about what was going on. It wasn't like the way the doctors were talking to me, all my specialists that I was seeing. So what I've been most grateful for is how much massage has helped me, and then how it's helped me to take what was a real problem in my life and help other people. And that's just, I'm very grateful for that.
Yep. And then you develop these awesome charts. I mean, these everybody should have it in every single clinic, you know?
Well, yes. Yeah. And what I did is I learned very quickly, you know, there's a lot for us to keep up with in the treatment room. The patient comes in and they give us all their subjective complaints, and I have systems that help you track those quickly. You have your objective findings that you come up with as you start to do your treatment and go about your assessment. And what I did is I needed a system where real quickly, no matter where someone pointed on their body, whether it was their thumb or a certain area in their head or a certain area in their back or their leg, that immediately I could have access to all the research information about, at least for me, myofascial trigger points, because that was so much a part of my pain and dysfunction, and it is for most people, because it doesn't matter what type of body work you do.
Yep.
All types of body work affect myofascial trigger points. So I just set up a quick system here. I want to, like this, what I did is I color-coded the body for myself, because I didn't feel like it was so important that I can't memorize everything. I just needed a quick system to get to the information quickly. So I color-coded different areas of the body. Anything that's blue would be head and neck. Anything purple would be the torso of the body. I know green is my upper extremity area and red lower. What that allows me to do is when a patient comes in, if they have pain in a specific area, like in the head, and I color-coded it down more, they could just point and say, oh, I get my headaches here in the red area, the temporal area. And then quickly, what I'm able to do is I just color-coded this out. I took Travell's research and I broke it down very simply, where then I could say, oh, you have pain in this area, this is where your headache is, before I start to treat, just in case I press on what's called a trigger point. And I tell them, you know, what trigger points, like when I press the trigger of a gun or pull the trigger of a gun, the effect's where the bullet is. If I press on a trigger point in your muscle, the effect, it could trigger a referral like to their headache.
I've never heard of the term that way, and it just makes sense.
It does, and the patient can relate. So I like highlight right on my chart. I go, so I'm going to tell you about trigger points. And so, because what happened with me is I'd go and the therapist would press on my upper trapezius, and I get this headache. And I go, is that normal? You know, or like I go, it's making my headache, and they go, oh, that's normal. Well, after they said that so many times, I was thinking that the therapist is full of it. You know, this is just their standard answer. Because my question was, are you sure you're not pressing on a nerve? I was scared. I didn't know anything. I didn't know what a myofascial trigger, but couldn't even pronounce the word myofascial or sternocleidomastoid. Therapists and stuff. So what happened is I needed to bring it down to a level that the patient could follow and So I tell the patient, they point to the red, and then you see all these color-coded boxes I have in each muscle. Box. What that does is like a muscle like the trapezius fires into 5 color zones. Well, if the person only told me about red, I just have to really look for red dots. So here is trapezius, I tell them. And then I go, now a few muscles down, we have the semispinalis capitis, I explain it to them. And I show them how they can get the referrals on the side of the head, or if I'm pressing on their neck and they feel it may be in the back, that pattern, I don't want them nervous, I'm not pressing on a nerve. I can tell them just below that is the splenius cervicis, and we need to watch for that. And then I can tell them the deepest one in there are suboccipitals, and many times I tell them I may not even be able to treat that deep today. And in essence, I'm basically telling them you're coming back for another treatment, or you need to consider it. So I've always broken these things down, actually, and I have it in a wall chart form. So like here on the wall chart, I think I have columns. So the columns, all the muscles on the back of the neck, superficial to deep, starting with trapezius, going all our layers. Column 2 is my muscles of mastication, anything dealing with the temporal mandibular joint, closing the mandible, moving it from side to side. Here is our column for facial expression, our frowns, our smiles. And then here we have our lateral neck with the scalenes and the sternocleidomastoid. And then we continue down platysma, we come into the anterior neck and then dive deep. So when the patient points to one spot, I can instantly lay out a treatment plan. Of course, each time I just take a moment and explain what part of the pattern that they may have, but all I have to do is by following these dots, I now have all the trigger points highlighted for myself based on research that could be causing pain into that area. After treatment, at the end, I can sit them up, I could tell them which ones were not involved, I could rate their muscle involvement, I could use stars, I could use a scale of 1 to 10 and say, this one was a 10. I could let them know which muscles we may not have treated yet and that we'll do on follow-up treatments. If I'm in a hurry, I know we always do our notes immediately right after we're done, but sometimes, I don't know, if it didn't happen, you could quickly write the patient's name on the chart is what I'll do. I'll take out my cell phone, I take a picture of the chart. So now I've got soap notes that I can basically go back and I can take that photo and attach it. And I also use the phone. I take postural photos. Part of my intake form is I'll have people, they say they're going to pay for today's treatment and that it's okay for me to treat them, and they give me permission to, take any photo, just like you would sign off for the doctor that it's okay to take x-rays. Every once in a while someone does not want you to, but I'll take a postural photo of them and then I can zoom in on it and I'll show them. Actually, here I have a page also.
But you even do it with the clothes on too.
Yeah, I have them leave their clothes on. Yeah, you do this in health food stores. You do it. You're doing seated chair massage somewhere. You take something like a flip chart and you can explain any pattern to them. You could take a photo of them right out there in the public with all their clothes, zoom in and show them, hey, you had a high shoulder on one side, low on the other, the head's forward, you could see the hands, the rounded shoulders. So we do things like that real quickly. And what I suggest therapists do, just like chiropractors very often, or doctors will offer free screenings, the chiropractors will offer maybe a free spinal exam. So there again, you could offer maybe a free postural analysis and a trigger point patient information session for no charge to be part of a package or something like that.
My only complaint is you're making things too easy for the therapist.
Hey, I think we need to have it easy. You know what? We got a lot to do. We're juggling our schedule. You're watching the clock. You've got the patient talking to you. Sometimes their information's relevant, and sometimes they're just like, they're not even in the treatment session with you. They're on their cell phone or something like that. And, you know, I think what's most important is that we're able to find the information, stay focused, you know, where can I look and see which shoulder was high or low, or if the patient goes, God, why was it sore on that side so much? You can say, hey, that's the high shoulder side, and you had the forward head posture. So sometimes I'll tell them, you know, it makes sense. These muscles are tight because it's pulling the shoulder up. These are pulling the shoulder down on this side. We had both the muscles in the front pulling the head forward. So it's just making it simple and making it user friendly, and that's really what mainstream medicine has done. You know, they make it very easy for the patient to understand why they've created the diagnosis, and of course the physicians always lay out a report of findings. And I think more and more as massage gives a report of findings, and just like the chiropractor at the health food store or out at a health fair or at any type of sporting event does spinal exams or postural exams, there's no reason why a massage therapist can't be doing the same thing. That's really what we're treating. We're treating posture.
Yep. And one of the thing I really like too, you're such a dramatic educator too and stuff like that. I mean, your classes, people, please go to his classes and stuff like that. It's never boring. Honestly, and you're going to get your head full of information too.
Yeah, well, you know, I teach with passion. I'm a real, you know, I'm licensed, but I go in the treatment room. I'm in the treatment room. I'm in there every week. I'm take the patients. I schedule them still, you know, myself now. I'm dealing with everything you're dealing with out there. So the information I'm relating to you, it's the reality of doing business, and it's changing. And you're carrying this technology in your pocket already. If you don't know how to write part of this off, you can. And then you take pictures of everything else. Why aren't you taking pictures of your patients and educating them a little bit? And what makes you different than every other therapist in town right now?
Yep.
Unless you utilize tools like this and you're showing them their trigger points and you're showing them their posture and you're educating them. Otherwise, you're no different than everybody else. So set yourself apart, and it's very easy to do with today's technology.
Yes, definitely. And then what's the best way for people to get a hold of you then?
A couple ways. You can go find me online, kenthealth.com. You can always Google me, David Kent. My toll-free number is 888-574-5600. So again, that's kenthealth.com. Google me, go to Facebook, so it's Facebook.com/Kent Health.
Yeah, perfect. And again, make sure you attend one of his classes, at least one of his classes. All of them if you can. So.
Hey, I want to thank you again for having me. It's always a pleasure to see you and see your family. You didn't bring them this time.
No, we don't.
But we missed you.
Yeah, okay.
We'll see you at the next show.
Thanks, David.
Take care.
Thanks, everyone.